Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: Chemical Safety. Just about every worksite has chemicals present, whether it is something as basic as dishwashing detergent or something as toxic as hydrogen sulfide. The symptoms of exposure to chemicals range from being severe and relatively immediate to becoming debilitating after years of exposure. Exposure to chemicals might be accompanied by warning signs, or it could be an odorless, colorless gas. There are many different categories of chemicals that may cause physical damage to the body. These chemicals can have chronic or acute effects. Listed below are the different types of chemical hazards. Toxic - chemicals that can have a poisonous effect on a person. Carcinogen - chemicals believed to cause cancer after overexposure. Corrosive - chemicals causing visible destruction or alteration. Irritant - chemicals causing an inflammatory effect. Sensitizer - chemicals causing an allergic reaction in tissues. Flammable liquid - a liquid that emits vapors that may catch fire. Combustible liquids - a liquid that combusts after being exposed to high temperatures. A few of the most common compounds and a brief description of each are listed here. Carbon monoxide - a colorless, odorless, and tasteless gas, which is non-irritating and less dense than air. Hydrogen sulfide - a colorless, flammable gas with an intense odor like the smell of rotten eggs. Benzene - a toxic substance, which is colorless with a sweet odor. Hexavalent chromium compounds - usually formed during hot work welding of chromium-containing metals. There are a variety of manners in which chemicals can be exposed to the body. The methods of entry are: ingestion — eating or drinking a chemical. Absorption — skin contact with a chemical. Inhalation — a chemical entering the body through breathing. Injection — a chemical forced into the body by a syringe or a high-pressure device. Some safety precautions that may help deal with chemicals in the work environment are: be sure to use all the proper PPE, including a gas meter when appropriate. Always read labels when dealing with chemicals. Chemicals should always be kept in their original container. Flammable and combustible chemicals should not be near heat sources. Always be on the lookout for chemical warning signs. Spills should be reported immediately. If chemicals are splashed onto clothing, the clothing should be removed immediately. If chemical exposure has occurred, the individual should seek the necessary medical assistance. Any individual that has worked with chemicals should wash thoroughly before eating, drinking, or smoking. In addition, office personnel may also be exposed to chemicals in the workplace and should not become complacent to hazards that may accompany these chemicals. It is important to remember chemical exposure may happen both on and off the job for all personnel.